COVID now. We're going to talk about today's update and an announcement regarding vaccine eligibility. We have received some good news over the past several weeks, and then again this week with doses being increased that in terms of the allocation coming to Louisiana. And this most recent increase, the previous increases have been primarily on the Moderna side. This next increase coming next week is on the Pfizer side. Now, that's the good news. The bad news is the shipments coming in for this week have been delayed. And the White House talked to us about this on Tuesday, and that's for a variety of factors. Employees were having a hard time getting to the pharmaceutical manufacturing sites in order to package things up, but then you had winter storm affecting closures at various airports where the distribution occurs. And so our large shipments of Pfizer and Moderna for this week, which normally would come in on Monday and Tuesday, haven't yet arrived. And so we expect to get those shipments. We don't know when. It could be Saturday or Sunday. And then Monday or Tuesday, we should get what would have ordinarily come on next week anyway. And Dr. Cantor is going to talk more about this. But bottom line is we're going to have to double up next week as best we can in terms of the number of doses that we administer in the state of Louisiana. But the good news is that the weekly allocations are increasing. We have at least 3 weeks of visibility on that now, and we've been told that those are minimum planning thresholds. And so we're more confident than ever that we can expand the number of Louisianans who are eligible currently to be vaccinated. And so I'm announcing today that this coming Monday, not today or tomorrow or Saturday or Sunday, but Monday, Phase 1B Tier 1 will be expanded to include teachers and support staff working on site in a K-12 school, but also staff at daycare facilities as well. In addition to that, individuals aged 55 to 64 with at least one of the conditions listed by the CDC is placing them at an increased risk of severe illness from the virus that causes COVID-19. And then finally, we're adding all pregnant persons. So this is an additional 475,000 people by our estimates that are being included in the current order of priority, again, starting on Monday. And the lists, because I mentioned that age 55 to 64, you're going to have at least one of the conditions. Those conditions are cancer, chronic kidney disease, COPD or chronic obstructive pulmonary disease, Down syndrome, heart conditions such as heart failure, coronary artery disease, and immunocompromised state, weakened immune system, for example, from an organ transplant, obesity, severe obesity, pregnancy, sickle cell disease, smoking, and type 2 diabetes. So if you have one of those conditions or more of them, and you're between age 55 and 64, or obviously if you're pregnant, regardless of your age, you will need to fill out a copy of the Louisiana COVID-19 vaccine attestation form, indicating the condition or conditions that you have for the vaccine that you are going to receive. The form can be found on the Louisiana COVID vaccine website. LDH is encouraging residents to print and fill that form in advance, but they're also working with the providers to make sure that it's going to be available on site as well. So this is very important, and as we signaled a few weeks ago, we intended for teachers and other school workers to be in the next order priority. We just weren't sure when that was going to happen. But being able to get to them is really important for our state. As we all know, they've been on the front lines of this pandemic, and they play a critical role in our continued recovery and obviously the education of our children. And we all appreciate teachers and support staff, daycare workers. I know I certainly do, and therefore very happy that we're going to be offering them vaccines starting next week. And I also wanted to thank Senator Cleo Fields for working with us over the last couple of weeks to make this happen in an organized fashion. We also know that older people and those with certain comorbid health conditions are at greater risk for having a poor outcome should they contract COVID-19. And that is why we are getting to those individuals 55 to 64 who have one or more of these comorbid health conditions. So the decisions we're making are consistent with the principles we outlined at the very beginning, and that is we were going to follow CDC recommendations, the ACIP recommendations, if you will, to the greatest extent that we could here in Louisiana, consistent with the overarching goal of preserving our hospital capacity and saving lives. And that is what we're continuing to do. And with respect to individuals who are pregnant, as you all know, we've had challenges around maternal mortality in Louisiana for many, many years. We've had a number of initiatives over the last few years to address that. This is a continuation of that, but also is faithful to the CDC's guidance that we should make the vaccine available to pregnant women. So if you are pregnant, you have access to the vaccine now. If you have questions, please speak to your doctor about that. But do get vaccinated because it is safe and effective. To date, we've administered a little more than 812,000 vaccine doses. And the last utilization comparison that I saw was in terms of the total doses administered, Louisiana was 11th in the country in utilization. And as for individuals who have received their second dose, was, I think, number 8 in the country. I don't know how that's going to shake out after this week with all the interruptions we've had around the country. But I mentioned that to let you know that our team here at the state, but also a lot of local partners and hospitals and clinics and pharmacies and so many others are just doing tremendous work in order to make sure people can get vaccinated as quickly as possible.